Good afternoon. My name is Bridget Ewald. I have been a speech therapist for the past 10 years. I currently work at the Northridge Health Center in North Ridgeville, Ohio. The population that we serve are elderly patients, approximately age 70 and older. And the most common diagnoses for our patients that we have is dementia. Today, I will be speaking to you all about falls prevention. I will discuss how to identify a patient that would be appropriate for falls prevention therapy. And I will provide therapy strategies and techniques that I have found helpful when working with a patient who has demonstrated recurrent falls and is a high risk for falls. Here, I have a case study of a patient that I recently was working with. Her name is Velma. She is a 76-year-old woman who was diagnosed with dementia. When Velma came to our building, she was receiving physical, occupational, and speech therapy under her skilled care. Once she was plateauing in therapy and no longer making progress, we discharged her from therapy services. Within about 3 weeks after her discharge, she was referred to therapy following 3 falls within a matter of 2 weeks. She was referred to us by the nursing department for the unit she was on. It was also noted within the referral that Velma was presenting with increased confusion and impulsive behaviors. When identifying a patient for therapy, there are several ways that we may receive potential clients. One, like Velma, is through the referral process. At the Northridge, we have a written referral that is given to us from the nursing department. So it could be either from her unit nurse or an aide that works with the patient. And on this referral, they are indicating that there has been a change in the patient's functional status. In the case of Velma, we were told that she was having increased falls. She was also having increased confusion and impulsive behaviors. Another referral that we get is through administrative meetings that our FRC attends. Every morning, there's an administrative meeting with the administrators of our building. And there is also a risk management meeting held weekly at our facility. At those meetings, patients are discussed, and it is noted any concerns or decline in their functional status. After those meetings, as needed, our therapy manager will refer patients to the therapy department for any screens and possible evaluations that need to take place. Once a patient has been referred to the therapy department, I will then do a screen for the patient for speech therapy. When I'm doing a screen for a patient, I will review their medical chart and I will indicate their past medical history, noting their diagnoses. And this will tell me if there is any diagnoses that could possibly place a patient at a higher risk for falling. Some of those diagnoses include dementia and Parkinson's disease. Within the packet of handouts you have received, you will see an interdisciplinary historical screen and data collection sheet. This is the screen form that I complete for any patient that I may pick up for therapy services. It is important when screening patients to completely fill out the form, including listing their prior level of functioning and any changes from their prior level. This will indicate the need for therapy services. With the case of Velma, I noted her increased falls, her increased behaviors, and her impulsivity. When completing the screening process within the medical chart, it is also important to note any new orders for that patient. This could include any changes in their medications that they are currently receiving. Some medications could have side effects that could place a patient at a higher risk of falling. Some side effects include increased dizziness and increased confusion. I will also consult with the nurses and with the direct care staff who work with the patient. When I was screening for Velma's case, I talked with nursing and I talked with her aides, and they were able to tell me any increased behaviors, any change in the level of care that they are providing. They explained to me her recent falls and her increased confusion. Once a patient has been referred and I completed the screen, I will indicate whether the need for an evaluation has been demonstrated. When I complete an evaluation for a patient, I will make sure to do a formal evaluation, doing a formal assessment of the patient. The assessments that I typically use is the mini mental state examination or the slums. The information I receive when completing the formal assessment is I am able to get a picture of the patient's ability to follow directions, their short-term memory skills, and their thought organization skills. I am able to indicate a need for therapy based on the score that is obtained from the formal evaluation. I will also do an informal assessment of the patient where I indicate any patient behaviors that I am seeing, including impulsive behaviors. And I will also note any informal assessment of their ability to follow directions. I may also ask problem-solving scenarios, as well as short-term memory tasks in order to get a complete assessment of the patient and of their abilities. Once I determine that a patient is eligible and appropriate for falls prevention therapy, I then develop a plan of care for the patient and start developing treatment approaches for the patient. Typical goals that I will use in my plan of care include problem solving, safety awareness, and memory skills. One of the treatment approaches I often use is utilizing a memory book for the patient. The memory book is used at every session, and it contains safety awareness concepts important for the patient in decreasing their risk of falls. I will utilize spaced retrieval technique where I review and read the safety concept with the patient and then have the patient recall the information following a specific period of time. The purpose and benefit of the memory book is for the patient to review and retain the information within the memory book. The memory book is important as it is an established visual aid, which can help the patient to process the information and retain the information that I want for them to learn. The way the memory book is developed, I review the concepts with the patient as I am writing each page. I will put one safety concept per page within the book. An example would include, I use my cow light when I need help. Putting one concept on the page helps the patient to retain the information. I will also emphasize cause and effect within the safety concept for the patient. If I get up on my own, I will fall. If I fall, I will get hurt. This shows the patient what can happen if they continue to get up on their own. Keeping the memory book simple with one concept per page allows for the book to be easy to read and utilize for the patient. Another treatment approach I have found helpful when working with a patient in preventing falls is bombardment of other visual aids. I will post signs within the patient's room, allowing for reminders of the safety concepts that we discuss within our therapy session and within the memory book in order to prevent falls. Common signs I will use will have the statements, I do not get up on my own, or I pull my call light when I need help, and I wait for help. The signs are posted within the patient's visual field. The visual aids are helpful in that it reminds the patient of the safety concepts that they are learning. The signs are simple, with simple handwriting or print. I tend to use white paper with black ink. This allows for less distraction of color for the patient. I post the signs within the patient's room with their help so that they can tell me where they're most likely to look for the information. For example, if a patient tends to watch a lot of TV, I may post the sign on the wall next to the TV. This way, as the patient is looking at their television, they are also in the direct line of vision for their sign, reminding them not to get up on their own. Having the patient's input in where to place the signs allows them to carry over and utilize the signs. Another treatment approach that I often use for patients is incorporating other therapy disciplines when necessary. Sometimes when working with a patient who is at a higher risk of falling, They may also need intervention from physical or occupational therapy for any physical deficits that they are presenting with. This could include things like transfers and balance, which can impact the patient's safety and increase their risk of falling. In the case of Velma, I did refer her to physical therapy in order for physical therapy to work with Velma on her transfers. Another therapy approach I use with patients in preventing falls is educating caregiver staff. I will usually incorporate this approach towards the end of my therapy duration with a patient. I will educate the staff on the therapeutic techniques and approaches that we found helpful for the patient. I will also leave the memory book with the patient in their room and have the aides or nurse review the memory book periodically with the patient. This will help carry over the concepts learned and decrease their risk of falling. At the Northridge, we are able to incorporate symbols outside of a patient's room, indicating a risk behavior. In the case of Velma, we have a star outside of her room, indicating that she is at a high risk for falling. The symbol helps to protect the patient's HIPAA status so that no identifying information is present. The purpose of the symbol is to allow any staff who work with the patient know that there is a risk behavior with this patient. Another treatment approach that I use and found successful with patients is encouraging out-of-room activities. When I do this, I incorporate other facility staff, including activities department. I will notify the activities department of a patient so that they can encourage the patient to attend activities within the facility. This allows for the patient to be out of their room and have less risk of falling within their room. They will also have the ability to socialize with other residents and other staff. I will also encourage any patient who currently eats meals in their room to eat in the dining room. This allows for the patient to always be within the visual line of a staff person. With all these approaches, it's important to keep the patient's needs in mind. We want to individualize our therapy approaches for each patient that we are working with in order to help carry over the safety concepts that we are teaching in order to decrease a patient's risk of falling. Incorporating and educating the staff also helps to carry over the therapy that was used in order to help the patient improve their safety and decrease their risk of falling.